head is, what's the most common problem that youth face when they come to seek help at this organization?
I'm trying to think what would be the most likely it would be something related to depression.
Okay.
We have two sides of our counseling services. So we're licensed by the state for substance abuse treatment and for depression.
Okay.
So we have the counselors who do each of those, but then we also are working really hard so that we can do both with the same counselor. So we work on getting our counselors dually certified.
Okay.
And so often it's hard to tell. So the young person might show up because they got in trouble, they got caught with alcohol after a football game, but in the course of working with them you might realize, well, this is really a depression-related issue, or this is really self-medicating bipolar. So I don't know that I've ever seen us say, oh, which do we get more of, because so often they go back and forth.
It's kind of like opening up Pandora's box.
Exactly. Exactly.
Okay.
But I would say, when you think about it, as you work in treatment with young people, there's just so much depression these days.
Okay.
So, how does identify problems that youth face in our community?
So we're actually doing services in this building. We have an office in Redmond and then another in Kirkland. So those are our main offices where we see clients. But we're in 80 different locations.
Wow.
So that was last year's list. Every year it's a little bit different. But we're in about 40 schools.
Okay.
So we're right, the counselors, the students might not even know that the counselor's from YES. So, they wear the tag and all that, but as far as they're concerned, these are these great people that are part of my school. And then also a lot of the teen centers, so for example, the Kirkland Teen Union building, there is a counselor who's there every afternoon.
Okay.
Now it's just, it's like kid says, well, I'm going to KTUB. And I say, well, I'm having trouble, I'm going to talk to Gretchen. That's how that works. It's built in with the services. And there's been a real commitment in the agency that it's great to have the offices where you can see clients on a treatment basis, but we need to be out in the community where the kids actually are. And then on top of that, this is great timing, our board always gets a program presentation before each meeting. And the program presentation includes a client. And most often that's a young person. Sometimes it's a parent, and then it's whoever's a staff person who works with them, so that they get a chance to actually talk directly with the young people. And this last month we had a panel. So when things get really difficult in a community, so with the shootings that happen, there's a lot of anxiety around that. We brought together the 7 students from different programs so that the board could ask them questions about, what are you hearing? How did this affect you? And instead of translating it through what our counselors might aggregate, they could actually, they felt it more deeply because they heard it directly.
Wow.
So
I think that could be really powerful, kind of like a two-way street rather than just...
Definitely. And when this building was built, they actually had a youth advisory board to the capital campaign. So they ran everything right down to the design of the building, got input from the young people, and in the end, the board committee chose 3 building type, 3 ways the building could be done. And they let the young people help choose.
That's cool.
And our director always says, it wasn't the one I wanted, but in the end, it really is, it's right for all the right reasons. And one of the things that none of the adults had noticed about this design is when you walk in, the front of the building goes like this, and to them, not only did that look like a Y, but it sort of looked like, you're opening
arms.
Okay, you guys win, great idea. And then also having it feel like a living room, and then have sort of a woodsy, natural feel like the wood has, was very much in the minds of, if you're going to be here, if you're going to spend time here and work on your stuff, why not have it be someplace that feels welcoming like
Yeah,
that?
we both noticed when we walked in.
Yeah, it's really
nice.
spacey and really
It's not,
open.
and it's not really institutional.
Exactly.
Yeah.
It doesn't feel. It doesn't
Feels
have
like
that
homes,
industrial.
yeah.
Well, and
feeling.
people have taken such good care of it. You know, again, having worked in YMCA's, which take such hard use because we've got so many people coming and going all the time. One of the biggest challenges is keeping even a new building looking really nice. We moved in here in the summer of 2008, and everybody takes such good care of it.
It looks
I don't know
brand
that
new.
I've ever seen anybody, do graffiti
Yeah.
and nothing. And people are just so respectful of the space, and I think it's because it has a good
Yeah.
feel, and we don't spend a lot of time turning people away. So I think there's just a nice
Welcoming.
welcoming presence.
Yeah. And when you have the kids involved in the creation of the space, they feel like it's part of
there's an
theirs.
ownership.
Yeah.
Yeah, and even years later, I think
Mm-hmm.
the story gets told often enough
Yeah,
that
because
kids
you're like,
still
oh,
feel that
maybe I
way.
could do something like that someday.
Right.
Yeah. Okay, so I've got another question for you. How does YES inform the public of the services that it provides? You kind of touched on that, how you're in the schools and you're in the
surveys
youth
of the young
centers.
people.
Yeah.
Yeah,
but-
so every year in the fall, we have a laminated poster that the young people helped design it. So like, if you were looking for help, this needs to engage you.
Okay.
And then it has a little tear-off tab that just says for confidential help, call. And then it also has the webpage and the info ad.
Okay.
And even though schools get it, we send it again every year with a new packet that has the basics, because school staff changes so much. And what schools have said, that's okay if you give us another one. We'll probably find a space, and who knows if the one you sent, even though it was laminated, might have gotten damaged in some way, or someone took it down not realizing we wanted to keep it.
Okay.
So that's a really direct way that we do that. We partner with a lot of other agencies, HopeLink. We've got the DSHS office right down the street, just making sure they know what's available, right down to the children's librarians. We meet with them every year and do a presentation. The school nurses, we inform the PTAs, PTSAs, because they're the sort of the involved and active parents. We have a Facebook page, which is really directed more towards the donor audience, but we still put in information that they might help connect, so that they understand, here's the kinds of things that can happen here. Because the biggest way that people find out that this is here is by word of mouth. So often that's the case with that is you're in that fog of crisis as a parent, and you might go to your doctor or someone and say, oh my gosh, the school said they found a suicide note or whatever it is, and you are just in a panic. And even if you heard about this 10 times, but not while you were in that mode, you might or might not remember. So we also do outreach to physicians, pediatric associates. Actually, one of their founding doctors was also a founder for this nonprofit. There's always been a good tie with the healthcare community. And then because even though we accept people of all income levels, we're the only provider of this type of service on the east side that our sliding scale goes to 0. We say nobody gets turned away. So if you don't have insurance or you can't afford,
That's great.
then this is the place where you should come, because we'll figure out how to make it work for you.
Wow.
That's great. All the way down to 0.
And then our webpage, we'd like a different and better, more, it's like, we look at it and we think of all the things it could be. And today I was like, I want someone to write an app. You know what? The young people aren't going to my webpage. They are, they want to do all this, and
Funky stuff.
because of HIPAA regulations, our Facebook page, so the Healthcare Information and Portability and Privacy Act.
Okay.
So we don't have anyone under 18 on the web page, just because there'd be the temptation to be, even though you might be okay with posting something personal about your situation, it's protected data because it's in our hands. So all of that info, so that's why we use it more as a donor communications tool, because then we don't get into the confidentiality issues of a young person being counseled. So those are tricky things, but it's very much, we use it very intentionally as that kind of awareness booster, so that if you ever need it, or you know somebody, you know, your colleague says, "Oh my gosh, I've got to. Do you know anybody who does counseling? My kid's having trouble." Or someone says that to you in your neighborhood or at church, you might say, "Oh yeah, I think I know. Have you heard
Make
about
that connection.
Why, yes.
Yeah.
So, yeah.
Very cool. All right.
So, how does YES measure the effectiveness of the programs that it provides?
So we have some things that we're contractually obligated to do, and some things that we do because we know it makes us be a good provider. So on the contractual side, all of our young people who come in to substance abuse, because we work within the state system, they're entered into their assessment, their progress, their treatment, all of that's entered into a database called GAIN.
GAIN.
Yeah,
Okay.
G-A-I-N.
Capital G-A-I-N. I'm not going to remember. But all the providers in the state are putting their information in there, which means that the state can actually can see what are the trends.
Oh, okay.
Is, we learned things like the first drug of choice is shifting from alcohol to marijuana now.
Yeah.
We could see, on a local and statewide basis, because we ask the same questions and we enter the same data, that the troubling use of Percocet and OxyContin, prescription drugs that you might take out of your parents' medicine cabinet, is shifting now to heroin, which is unfortunately cheaper.
Yeah.
And it's
Probably easier
but
to get,
scarier.
Yeah.
All those things. So that's a really great thing. So we can compare ourselves
See
to other
trends.
providers, see our outcomes measuring up to others. Then with United Way, we have United Way contracts for some of the services that we do, and with that we have to report on our outcomes every quarter.
Okay.
And those are client-based, so the client report, we look at, what was your treatment plan, were you successful on your treatment plan? And with that, we have 89% success rates. Yeah, so it's really great. So there's a variety of measures depending on what the program is. So we're always collecting that data, asking questions that are based on not so much did you see them, did you serve them, but it's really on what happened here makes me, I know more about where I can get help, things like that. So the United Way outcomes are a big part of that. And then we do a client and parent satisfaction survey every spring.
Okay.
So letting them tell us more about their experience with the agency. So that's less about, the outcome, how are you doing treatment-wise? It's more about how did you feel?
How you feel?
How do you think it takes too long to get appointments? Just all of those things that help us look at our services and then how they're delivered.
All right. Where does YES get most of its funding?
Right now, it's about almost a third comes from fundraising.
Fundraising, okay.
And then, in fact, it's shifted a little bit, which is actually good. So we have government fees and contracts is about a quarter, so about 25%.
Okay. So is that like grant writing and?
No, those are, so that's actually, so the municipalities, City of Redmond, City of Kirkland, City of Bellevue, City of Sammamish, we have contracts with them that we apply for every 2 years.
All right, okay.
So that would be that sort of thing, school district,
So just,
anything that's a government entity.
okay.
Then prepaid health plan is about 29%,
Okay.
which is a Medicare program. I mean, it's dollars that come to us through the county, but it really starts at the federal level.
Okay.
So but it's
So it's
meant for very low income
government
people.
provided health care. Okay.
Then people who actually pay for services is right around 11%.
Okay.
United Way is about 4%.
Okay.
And then all the rest is contributions.
Okay. So the contributions, how are they different than fundraising?
Well, that's what I mean. So
Oh, okay.
all contributions.
Okay.
So
Okay.
in some cases that's donations of time
Oh, okay.
and or pro bono.
Mm-hmm.
We do a big special event
Mhm.
every year that raises about $500,000,
Wow.
and then the grants
Okay.
and other sources.
Okay.
So yeah, those all. We're trying to get to 32%. We're not quite there yet, so we're like right at 30% right now for the all things that are related to
Oh, okay.
fundraising.
Okay.
What do you normally do on the fundraising? What's the most used approach?
The biggest is the breakfast that we do. So March 19th
Which
is the
you said,
next
yeah,
one,
it's coming up.
and so we have people who connected and understand. They come up, they step forward as table captains or corporate sponsors, and they recruit people to come and sit at their table.
Mhm.
They hear the story and they give at a pretty impressive rate. Then about last year, so of our total goal last year, about a third was corporate and foundation grants. And then just people are just generous. For example, if you read the Times, the Seattle Times, they do the Fund for the Needy every fall. We're one of the 11 agencies that they split the proceeds for that. So that, right there was $33,000. So that's a big amount. Yeah, and then we have some neat things like Nintendo and Valve, which is a video game company.
Yeah.
They do employee garage sales.
Oh.
So the employees bring stuff in and sell it to each other,
Oh,
and
wow.
the proceeds go toward
Oh, that's really
a
neat.
nonprofit. So in both cases, we're one of the beneficiaries of that. So there's just
That's
really
fun, yeah.
creative, and
Innovative ways
yeah,
to.
it's really nice.
Yeah.
So and then you get a corporation like Microsoft where they match hugely, and so it's a very generous community.
Yeah, I think
fortunate.
we're lucky in this area. Our services, I think, are really well funded comparatively.
Yeah. I know it's been hard for arts, but one of the things about an economic decline like we've had is people know, gosh, if your house just got foreclosed on and your family's under horrible stress, imagine what might be going on for those kids who went from, we go to Disneyland every year to, I'm not sure where we're going to be living. So that has been a really positive part of a sad time.
Yeah, hard times can kind of help pull people together.
Yeah, they do.
It's great.
Okay.
So, since we are in a psychology class, we've been learning about the different fields and the different approaches that psychology uses and the different, what's the word I'm looking for?
Techniques, methods.
Yeah, methods. So we're wondering if there's a popular approach or a counseling or therapy approach that YES uses more than others.
So people like to use initials in this field, as you will find. Yeah. So right now the biggies, cognitive behavioral therapy is a big, so CBT, and then there's trauma-based therapy, which is sort of a sub of CBT, but they're specific to someone who's been through a trauma. And then we just took a team through DBT, dialectical behavioral therapy.
I haven't learned about that one.
It's kind of the in training.
Dialectical
behavioral therapy. And you can, it's a model, best practice, tested model. You can only get the training from the DBT people. So, and they turn people away. So you have to send, we applied once and got turned down, and then the next team that we sent in was accepted. So we just started adding that as a new model that we can use.
Do you know what institute or who created
I think
it?
they're just called
the DBT.
the dialectical behavioral therapy. It's interesting because
I'm actually
a psychology major. A long time ago, I'm sure I would not have any of my classes count for anything except for statistics. I mean, you kind of never lose statistics.
It's a hard Nice hard science.
So yeah, it's a big deal. And when I asked the same question, because we actually had a foundation that said, you know, one of the women in this family foundation, her child had benefited from that elsewhere, and so she said, you know, what can I do? How can I help support you getting a team trained? And so that was how we were able to push forward on it. So.
It seems like things are always changing, but it seems like they're always getting just a little bit more effective, a little bit more pinpointed to the issues.
And it's really I think it's when I look at it, when I look at the model, it's sort of a next level from cognitive therapy.
Oh.
And when I was studying, they didn't call it CBT, and someone hadn't trademarked some part of it. There was different.
I actually have it. It's CBT now. They actually teach it in our class, just recently about cognitive behavioral, last chapter.
Yeah.
So it's fun.
So it was, the battle when I was studying, it was, who were you going to be, a Freudian or a Skinnerian? So were you going to be, those trying just psychotherapy, or, is it nature, is it nurture? So.
It seems our professor, he's really big about having an eclectic
approach
to
things. So he combines those.
Yeah, he's got couple degrees in a couple different psychology
branches.
areas, so he's really good at mashing it all together, which
is great.
I think it makes sense depending on what you're focusing on.
The best part of that is you're learning about learning and being able to make good judgments about what works and what doesn't work, as opposed to being trained in a particular way. And given where you're going to go and what you're going to do, it's such an evolving area, and some of it is in the interrelationship side of counseling, and a lot of it is just we're learning so much about people's brains and the human genome and all the rest that who knew? I mean, who had any idea that we would start to find
certain
markers?
Right.
So that's I think it's an exciting time, but.
Yeah, just the tip of the iceberg.
Gotta know how to keep on learning, no matter how long it is.
So I have a question about the dialectical behavioral therapy. Could you explain a little bit more on how that works, as in?
Because I'm not part of the team, I'm not as familiar
generally
with the specifics, but it's a model that through back and forth, it's you're drawing out of a young person their own solutions. So it's very much it's in the process of dialexis, so dialogue back and forth. So you're measuring, trying, so that they actually see where demonstrable progress. So that's
kind of helping them create their own knowledge, create their own solution.
And there are, for the clients themselves, there are entities that offer, for a teen, like an immersion in DBT. So you can go and, really, on the client side of it, really get fully versed in that. Now we're just at the very beginnings of figuring out how do we incorporate this as another tool for the agency. But we're excited to see what happens going forward.
It seems revolutionary.
Yeah. It has some really great, and they've married it very carefully to not just we think it works, but true data, looking back at 5-year success rates and things like that. So that's part of why it's considered to be a good way to go.
It's encouraging. One question, which I think was really interesting, it was from a girl who couldn't come today, but she was wondering, are there any myths that you would like to correct about youth and their problems, or they're addressing their own mental issues? Are there any sort of stereotypes or myths out there about youth and mental health issues?
I think the biggest myth that's being exploded is that it's